We understand that you have come here during a difficult time in your life. We feel called to walk this journey beside you and believe the work we do is sacred. We know that this is a process and that building resiliency, or the ability to adjust and learn to function to new stressful situations, takes time. We believe that all individuals have rights and a voice in treatment that will be met with respect and dignity. This slideshow presentation has been designed for adolescents and their parents or guardians to act as an introduction guide to the Kettering Behavioral Medicine Center. The first thing we want to say is welcome. We are pleased to serve you at Kettering Behavioral Medicine Center, or KBMC for short. We have been serving our community for over 20 years. We offer a variety of services to the community, including inpatient, partial hospitalization, and outpatient services. Our goal is to infuse effective treatment through evidence-based practice and trauma-informed care to provide the best experience to our patients and their families. In the next few slides, we'll try to help you understand what the next few days will hold. Hopefully, knowing this information, you'll feel a little less stressed or anxious about this admission. This is the typical KBMC cycle. Usually, it begins in the community or at home. There's a crisis or a variety of events that encourage a behavioral health evaluation. Sometimes this evaluation recommends or requires the need for an admission to a facility, like KBMC. The psychiatrist will meet with your child within the first 24 hours of admission. Pre-planned, structured programming will be offered during the day hours. We will have meals and snacks offered throughout the day. We have scheduled visitation every evening. There are 2 sessions, the Patient Evaluation Conference and the Family Session, that you are encouraged to attend with your child. Shortly after these sessions, your child will be discharged. In the next few slides, I'll try to explain these different steps of the cycle in a little more detail. The purpose of this admission is to stabilize for immediate safety of the patient or others. The typical admission here at KBMC is anywhere between 3 and 5 days. Due to the short stay, we do not provide traditional therapy. We provide an introduction to healthy coping skills that will prepare you for outpatient therapy. When you arrive at KBMC, you'll be met by a security officer. The security officer will then go over security precautions with the patient, and then the nursing staff will complete a skin safety or wellness check. Due to safety and privacy restrictions, only certain items are permitted on our unit. We will provide that list to you at the admission to KBMC. We recommend our patients dress in their clothing. We recommend that you bring tank tops, t-shirts, or long sleeve shirts depending on the weather, jeans or pants, sweatpants or sweatshirts. Your child can wear slip-on shoes or slippers while on the unit and store gym shoes with laces in their locker. We do have laundry anemones here on site, but we recommend that you bring a few undergarments and socks for use during admission. If your child prefers a certain brand of shampoo or conditioner, body wash, deodorant, or other products, they may bring them to the facility, but these items will be stored in their locker for safekeeping. Staff may help them throughout the day to obtain these items for use. If your child has schoolwork or an appropriate book they would like to read, you may bring these in too. They may be used during appropriate times of the day. Your child will be assigned one of these psychiatrists during their stay at KBMC. One of these physicians will see your child daily and manage their care. Weekends and holidays, however, may be covered by an alternate KBMC adolescent physician than the one that is typically assigned for daily care and routine management. Your child is assigned a large team of staff members during their stay at the hospital. Each staff member has a different education background and all expertise in adolescent mental health care. In addition to the child psychiatrist, your child is assigned a clinical care manager or social worker who will direct their care and discharge planning. Your child will also have a large team of psychiatric registered nurses, mental health technicians, therapists, and educators. Each team member is an essential part of our team. Our goal is to provide a safe and nurturing environment, along with mental health consultation, diagnostic services, and treatment. Additional professional consultations and referrals will also be provided as needed. Kettering Health Network has a fully staffed pastoral counseling service. The chaplain is an important part of our healing team, and he is available to meet with your child if requested. The psychiatrist may prescribe medication to your child while they are admitted to our unit. However, we will not administer medications without your permission. We are required to obtain consent for all medications we administer. During the admission process, we will obtain consent for the common as-needed medications and previously prescribed medication. If a new medication is prescribed during their admission, we will call you to obtain verbal consent for the medication. Verbal consent must be provided to 2 KBM staff members. It is imperative to follow up with physicians after discharge to monitor for side effects and ensure effectiveness of the medications prescribed. There are 3 different types of medication terms at KBMC. The first is a scheduled medication. This medication is administered at a specific time of the day. The example listed is an antidepressant. Depending on the adolescent, they may take an antidepressant at night or in the morning. The second type is an as-needed medication. This medication is prescribed by the physician, but is not provided to the patient unless it has been requested. The as-needed example is Tylenol. If your child states they are in pain, they may have Tylenol administered by the nursing staff. The final type is an emergency medication. This medication is administered if the patient is a danger to themselves or others. An example of the emergency medication may be Ativan or Vistaril, depending on what is prescribed by the physician. Now let's talk about commonly prescribed medications. There are 2 types of medications typically used on our unit. The first is a selective serotonin reuptake inhibitor, also called an SSRI. These are the most commonly prescribed antidepressants. They can ease the symptoms of moderate to severe depression, they're relatively safe, and they typically cause fewer side effects than other types of antidepressants. This medication is ordered at a scheduled time, meaning it is given in the morning or at bedtime, and may take up to 4 to 6 weeks to obtain optimal effect. This is why it's so important to follow up with the outpatient physician to ensure the medications are working well after the short stay in our hospital. Examples of SSRIs include Celexa, Lexapro, Prozac, Paxil, and Zoloft. The second medication that is often prescribed on our unit is either Vistaril or Benadryl. These are used as a sedative to treat anxiety and tension. These are usually ordered as needed and would only be available to the client if they requested it. KBMC offers a semi-private room with 2 beds, 2 cubby shelves, and a bathroom. The bathroom is equipped with a toilet, a sink, and a shower. There have been a few safety modifications to our rooms and bathrooms. The door handles have been crafted into a cone shape, and the faucet is less curved. There are other safety features in each room to ensure your child is safe while on our unit. KBMC offers a variety of groups in education. We focus on healthy living, positive coping skills, spiritual health, relationships, and recreation. Our activity therapy room is where the patients will explore hands-on leisure activities and/or sensory-based activities led by our occupational therapy staff. They facilitate increased self-awareness, social skills, creative self-expression, and functional daily living skills to improve self-esteem and coping ability. Our facility also offers a large courtyard with beautiful landscaping, benches, and picnic tables. You may find patients enjoying nature, doing yoga, or smelling out of our box of essential oil plants. KBMC has a playground with open space for throwing frisbees or kicking balls outside. There are also swings to play on if you're not busy playing cards or socializing under the umbrellas. We also have a full-sized basketball court or a gym. We have this room set up to include many different games. Volleyball, basketball, soccer, and many more games happen here. We do have a set of rules to follow while we're in the gym. We remind our patients to be respectful to themselves and to others at all times, to wear shoes, to demonstrate a positive attitude, to use appropriate language, to demonstrate good sportsmanship, to cooperate with one another. And we use gym as a coping skill. We always put our stuff away, but most importantly, we always have fun. We provide many healthy options in our dining cafe. We have a fresh salad bar, a deli sandwich station, and our sous chef provides fresh, delicious options on our hot deck at each meal. We typically eat in our dining room, but occasionally we will eat outside if the weather's nice. We also have a dietitian on staff that is available for consult and provides education to our patients. At admission, you will choose a password or a code word. You will need to remember this code word when you call the unit. All callers and visitors will need to be in the call and visitor list and will need to have that code word in order to obtain any information about the patient, to speak to the patient, or to visit the unit. We always welcome phone calls from family at any time. We are happy to speak with you about your child. However, due to programming, your child may be unavailable to speak on the phone. But as soon as they are available, we will have them call you back. Visitation is from 6:15 to 7:30 every day. We encourage you to come every day if you can. If there is a safety concern, we may have to use seclusion and restraint. This is only used as a last resort. Seclusion is defined as being alone in a room when ordered by a physician, where staff can view the patient via camera. A restraint is defined as mechanical restraints used to hold wrists and ankles against a soft mattress when ordered by a physician. The physician may order this if the patient becomes violent or aggressive, or if they are not following safety instructions. We only use seclusion and restraint as a last resort, and only as long as absolutely necessary. Our goal is to be seclusion and restraint free, so we are always chasing zero. This is an image of the mechanical restraints used on our unit. You will get a chance to sit down with a physician while your child is admitted. This meeting is called a Patient Evaluation Conference, or a PEC. Please write down some questions you have for the doctor and come ready to talk. Some frequent hot topics discussed during this meeting are medication questions, discharge plan, outpatient treatment recommendations, home safety solutions, and therapist recommendations. This session usually takes place in the morning, 1 to 2 days after admission to the unit. We aim to schedule the PEC and the family session on the same day because we highly encourage parents and guardians to be physically present for these meetings. During the family session, the therapist, the patient, the guardian or parent, and appropriate family are invited to attend. Frequent discussions in the family session include general information, coping skills, distraction techniques, aftercare information, discharge information, and special topics assigned by the physician. Discharge from KBMC is a continuation of the healing process. We will help set up outpatient treatment options that will help your child for the long haul. On the last day of admission, your child will complete a discharge safety plan. The discharge safety plan is a piece of paper your child will complete with the help of staff. This will be provided to you at discharge so you are aware of the effective coping skills they have developed, the support systems they have available, and any risks at home or school. We only want what's best for your child. Please bring questions to staff and we will be happy to help explain or find the answers. Thank you so much for listening, and please call us if you have any questions. Our phone number is listed on the slide. It is 937-534-4601.